Colon, rectum and anal canal form a major part of our gastrointestinal tract. Cancers of the gastrointestinal tract are common, but the colorectal cancers are much more commoner than the other cancers of the GI tract. Why are we seeing more cancers, by the way, in the colon and the rectum? It is because of the risk factors we are exposing ourselves to. To name a few, obesity is one of the major risk factors. Lack of enough fiber in the diet is another risk factor. Consuming excess meat and fat, red meat, is another risk factor. Consumption of alcohol is another risk factor. I think the colorectal cancers are on the rise. One, because of the risk factors we are exposing ourselves to. Two, the longevity, because we are living longer now. 10 years ago, the length of survival in India, the average length of survival was 50 plus. Now, we are all living about 68 years. That's the average lifespan. So the longer we live, we get exposed to risk factors and we can have cancers as one becomes older. That doesn't mean that we shouldn't live longer. We should live longer. In addition, we have better diagnostics, better therapeutics, better decision making, technology, skill, expertise, and that is what making us live longer, and that exposes us to more cancers. So what are the symptoms of colorectal cancer? Change in the bowel habit. So something that is not usual for you, going to the toilet many number of times or not going to toilet enough. Bleeding in the back passage, passing blood in the stools. Weight loss. Feeling lumps either in the tummy or in the back passage. Having anemia, lack of blood in your body, are some of the symptoms of colorectal cancers. Having a family history is another significant risk factor, that one of your family members had colorectal cancer and you need attention. So when one is suspected to have colorectal cancers, the doctors examine you, the doctors investigate you, try and pick up a piece of tissue from the cancer and confirm that it is cancer. Once it is confirmed under the microscope that it is cancer, you are staged through various scans, and the aim is to pick up cancers earlier on. Once we pick up early stage cancers, we can cure colorectal cancers, and that is the most important thing about colorectal cancers. It is not something that you should be worried about, you should be concerned about. Once you have these manifestations, investigations, treatment, management and cure, this is what we see in colorectal cancer. So ladies and gentlemen, what is important is to understand that it is our own making that we are putting ourselves through a lot of risk factors. Try and cut down on the risk factors, be aware of the symptoms, and as soon as you feel that there is something wrong, see a clinician who can help you out. In summary, colorectals are common. We are seeing them about 4 to 6 cancers per 100,000 in the normal population, and these cancers are curable provided they are attended to on time. Thank you and have a good day.